So I wanted to just give a very brief overview of where we are in the pandemic. I am not a physician, but I will just kind of tell you what the messaging is, what we've been hearing from my director, who I just got off the phone with, Dr. Galley. And then I want to just talk a little bit about My Health LA, which is the program that I run. So you all may have heard yesterday in Dr. Galley's presentation, her briefing, where we are. We are in the middle of the worst surge. Record numbers of COVID patients. Today, we have 336 COVID patients at our hospitals, and we, again, are below 100 ICU beds. Hospital admissions doubled in the past few weeks, and across all hospitals in LA County, we still have available beds, but only 66 available ICU beds and only 346 total beds. And same thing among our 4 DHS hospitals, we only have 18 available ICU beds. So my colleagues have been talking for the past few days about that this is really an untenable situation. I mean, this is what it looks like. Long waits in the ER, long waits to get offloaded from an ambulance, redeployed nurses, new areas for treating patients, record deaths, dwindling numbers of staffed ICU beds, canceled surgeries. I mean, to me, each and every one of these could make for an interesting story, especially the kind of nurse staffing issues. All these hospitals are asking for waivers from the state to be able to operate out of, to work out of ratio. We're talking about something called team-based nursing. So those are really interesting stories. The other big story, of course, is the vaccine. LA County Department of Health Services is going to vaccinate 6,000 people in our workforce alone by Christmas, and 10,000, as we get the second shipment in, 10,000 people by the end of the year. We have a press briefing tomorrow with Dr. Galley, with Supervisor Solis, and with our head of our vaccination effort. And so I hope you guys got the information about that. Otherwise, I can send that along. And we are really, and also my colleagues at the Department of Public Health are holding a town hall tonight about the vaccine in general. We have not started messaging or talking about the vaccine for the public or our patients yet, but it's coming soon. We also are really encouraging people to get the word out to your communities, and you guys play a critical role in that, to tell people to stay home for the holidays and to really not go out unless they have to. Also, if you are not having an emergency, don't go to the emergency room. So emergency rooms are for emergencies. Always have been, but it's really critical now. We have people showing up who are not that could get care elsewhere in other settings, or from the COVID advice line, or from their primary care provider by phone. So those are some of the messaging that just keep thinking about. And then testing, we still have our 180 plus testing sites around the county. We started an at-home testing collection for the holidays. There was a press release a few weeks ago, really good story. You can get your testing kit mailed to your home. And also we're starting mobile testing. So kind of like pop-up mobile sites, including up in the Antelope Valley, if anybody is located up there. Okay, so that's kind of an overview of where we are in the department. I wanna share my screen because I wanna give you just a quick overview of My Health LA. So my role at the department, I'm actually an interim communications director, but my normal role is I run a bunch of community partner programs. I help with connecting our patients to resources. So this is also another story, I think, that we screen our patients for food insecurity, housing insecurity, and other issues, and then we connect them with resources with something called 1Degree. onedegree.org, the number 1degree.org. And it's like a community platform. We're rolling it out across the department, and soon we're going to take it out to the community. I also oversee a program called Medical Legal Partnership, which would love to get more coverage of. We put lawyers in health clinics to help people with their legal issues that affect their health, like domestic violence, housing, evictions, benefits problems. So the lawyers are actually work very closely with the doctors, and they help patients deal with legal issues so that they can be healthier. Okay, but My Health LA. So you guys may have already heard about My Health LA, I hope. It is, I'm just going to give you like 2-minute overview of the program and then talk a little bit about a few interesting things about it. It's a primary care program. It fills this gap. So after the Affordable Care Act, there's one population that didn't get covered. If I were in the room with you, I would ask you to raise your hand if you know what it is. If you want to type it into the chat, that's great. But there's one population that didn't get covered, and that's the undocumented population. We do not ask for documentation status. We do not ask their immigration status, but we know that our folks, our participants, do not qualify for Medi-Cal. So it's not health insurance, but these are people who are eligible. Anybody who is uninsured and not eligible for public insurance, they live in LA County, they're 26 and older, and they're low income. All the kids are already on Medi-Cal, so we don't need to cover them. The breakdown is primarily Spanish speakers. We do have, Asian populations, African American populations, but and other kind of smaller groups, right? But it's predominantly Latinos, Spanish-speaking Latinos. And we pay the community clinics to take care of our patients. So there's 52 agencies, places you have heard of: St. John's Well Child and Family Center, Venice Family Clinic, Queens Care, Altamed, big and small clinics that take care of our patients. And those are the patient's medical homes. That's where the patients go for care for 12 months. And then they can switch if they want when they re-enroll. They enroll at their clinics. They do not have to give their immigration status. Like I said, we don't ask. And they get a little card, like an insurance type card, even though it's not an insurance program. They can't go to Cedars-Sinai or other places for hospital care, right? They are within our system, our network. And they get a variety of things: basic labs, medications, primary care, dental care, emergency care if they need it, or specialty care at the Department of Health Services, mental health care, substance abuse treatment through our partners at the Department of Public Health, and mental health care through our partners at the Department of Mental Health. Here's our website. I encourage you, if you want to learn more about the program in general, to go there. And here's these new cute flyers we did in English and Spanish to raise awareness about the program at the clinics. Okay, so that's like the big picture overview of the program, but I want to talk just about a couple of things related to it. During the pandemic, to me, a program like this is essential. Like, we are, as a department and as a society, need to make sure that people are covered during the pandemic, so that when and if they have health issues, that they have somewhere to go. Our enrollment has dropped somewhat last year because of public charge and because the young adults became eligible for full scope insurance, Medi-Cal. So we lost some there. We've also had some enrollment drop this year because people aren't renewing in their coverage. They're not going into the clinic as much. It's just maybe not on their mind as much. We have made some changes to the program because of the pandemic. People can, instead of showing up at the clinic for enrollment, they can actually call and do enrollment or renewal or re-enrollment by phone. And also, the clinics are seeing a ton of their patients by phone. And the clinics have dealt with lots of challenges because of the pandemic. They've lost staff. They have had COVID outbreaks, et cetera. So we work very closely with them. We also started a texting campaign for the first time ever to text our patients and our participants about really, really important messaging on COVID safety and community resources. We wanted them to know what they need to do to stay safe. So we rolled that out over a course of a few months, and how to connect people with financial help, food help, everything they might need with our other county departments. Lots of our community clinics in My Health LA are also doing testing, COVID testing. We helped them get started so that people can go. It's one-stop shop. They don't have to go to Dodger Stadium, and they could go to their clinic and get testing at their clinic site. We all have a few worries. We're worried about people avoiding care. because of the pandemic, and also still remnants of last year and the year before and so forth with immigration fears. Of course, we're going to have a new president, but there's been a culture of fear and because of immigration policies and practices under President Trump, and our patients have been impacted. And then the last thing I'll say before I hand it over to Marion Brown, because I know she has a hard stop, and then we can maybe come back to me for questions. But I'll leave Pilar to let us know. The last thing I say is I think one of the best stories about My Health LA, in addition to just the program itself being critical during this pandemic and during this time, like that would be a great story in and of itself. But I think one of the best stories about My Health LA right now is this mental health program that we are doing with the Department of Mental Health. They gave us $5 million or they're paying $5 million to us to pay the community clinics to provide mental health prevention services. This is like coping skills, stress management, dealing with grief and loss. And we've trained, the Department of Mental Health has trained staff at the clinics so that people don't have to go and get referred out necessarily. They can get their mental health prevention services right there at their clinic. It reduces the stigma. Anyway, we're really excited about it. We rolled it out in July, and it could not have come at a better time because there is so much stress. These families are dealing with job losses, homelessness, stress, loss of death, right? Family members dying in the pandemic. So these sort of skills and coping skills are really essential. So I would be glad to talk to you all more about any part of anything that I work on here at the department.